Hi, everyone. Thank you so much for joining our webinar this afternoon. We are going to give it another few minutes for everyone to join, and then we will go ahead and get started. All right, we are going to go ahead and get started. Good evening, everyone, and thank you so much for joining our webinar titled SkinPen's Significant Role in My Practice, a Dermatologist's Evaluation and Perspective. My name is Lauren McCallum, and I'm the Marketing Manager for Crown Aesthetics, and I'll be helping to moderate today's webinar and discussion. Our webinar is scheduled for roughly 1 hour and will include a large number of pearls that we strongly believe will have tremendous value to you. Before we begin, let me share with you just a few housekeeping items. During the webinar, all lines will be muted to avoid any background noise. If you'd like to ask a question, you can do so at any time during the presentation. To submit a question, please submit through the question box at the bottom right-hand side of your window. We'll share the questions at the end of the webinar, so feel free to submit them at any time. So let's go ahead and get started. Crown Aesthetics is delighted to introduce you to Dr. Todd Schlesinger. Dr. Schlesinger is a board-certified dermatologist and clinical investigator with over 100 peer-reviewed publications. He is the founder and director of the Dermatology and Laser Center of Charleston and is a current member of the AAD Board of Directors. We are so excited that he has agreed to share his insight on how he utilizes SkinPen in his practice with you today. With that, the floor is yours, Dr. Schlesinger.
Lauren, thank you so much. And I wanted to take a moment also to thank Crown Aesthetics for having me this evening, and Mike Zucala and Brian Patton and everybody over there for having us. And I also wanted to thank everybody on this call for joining and allowing me to share some pearls with you and some great information about a device that we really love in our practice, the SkinPen. So as you can see from this first slide, it's Crown Aesthetics Skin Science for Life, which I think says a lot. And I think you'll see that this company is dedicated to the science of skincare and to the device that we're talking about tonight, and to PRP as well. So we're going to talk about both things, the SkinPen as you see, and also the ProGen PRP system, and how we sort of integrate those together in our practice. Now, as Lauren mentioned, these are sort of my credentials. I'm here on behalf of Crown Aesthetics to speak with you this evening. You've already mentioned some of these things. I'm joining the board of directors of the AD in 2023, but elected thanks to the members. I'm very excited about that. But in addition to that, we do a lot of aesthetics in our practice. Our practice just basically, we have 3 offices. We have 6 clinical providers. We have a research center. We also have a laser center with MediSpa. So it's not too atypical of a dermatology practice. That's a full service practice. We offer skin cancer surgery and everything that you normally would expect from a derm practice, but we're also dedicated to our aesthetics. And on that note, aesthetics have been growing. So microneedling is something that's near and dear to my heart for many, many years. I really enjoy doing that in the practice. As you can see, among the 10 most researched minimally invasive cosmetic treatments, from a couple of years ago, through 2019, you can see microneedling is sort of working its way up. I mean, it started sort of as an unknown, and there's still been a lot of variability in the devices that are out there on the market. But as we've gotten better at safety, at efficacy, at the standardization of the treatment, as we'll talk about, it's increased in popularity, mainly because the outcomes are getting better. And so that's important. So we're going to move forward and talk about SkinPen. So, the basis of this presentation is why really every busy practitioner needs one of these devices. And I choose this for a number of different reasons, and we'll talk about each one sort of in turn as we go through this presentation. And of course, at the end, have time for questions and answers during our time together tonight. So main points that we'll talk about the needles. That's important to look at the superior quality of the needles that are used in a device. There's a ton of devices on the market. Needles make a huge difference because if you have needles that are of good quality, you get good, smooth, clean penetration into the skin without irritation, without jagged edges forming in the skin, without catching. You get a smooth treatment that's less painful for the patient, but you also get longevity of the needles. So if you're treating larger areas, you want to be able to have good quality needles. You may want to treat a face. In our practice, you may want to treat a décolleté. We treat legs sometimes, we treat forearms. We have a number of different patients that we treat, but mainly face and neck are the places where we use this device the most. So commitment to safety and sterility. This device will talk about how the speed is maintained. We'll go through that. 7,000 RPM, it's a very well-maintained speed. It's very powerful, very smooth, good power, good battery life. These are all the things that you want to look for. And you also want to look for a device that's gotten good quality contamination prevention, because that's the concern that we have with our patients, is to prevent any cross-contamination or infections. And you also want to see validation to penetrate at the chosen depth. This means that if you set the device for a certain depth, say it's 1.5 millimeters, if that's the depth you're going to set, then you want your device to be proven to give you that depth. And there's a lot of studies that show that many devices do not meet that. So that's something we'll talk about as well. So looking at these needles, so right here, this is one of the big things that sold me on SkinPen. This is an independent third party that took a look at needle quality and sterility. And as you can see, the SkinPen needles are the straight, sterile, sort of clean, and excellent in all parameters, including the finish, the alignment of the needles, the condition of the point, prevention of contamination, and then just general overall quality. And they use the SkinPen with 4 leading competitive microneedling pens, 3 of which are actually still on the market. As you can see, a poor quality or adulterated needle, as you can see on the surface here, will have consequences in your treatments. The hooked end, if any of you ever inject lidocaine, whatever, if you have a needle that's not sharp or Botox, you'll know it right away by pain, and also the skin sort of reacts. It sort of depresses. You know, it's an elastic type of material, as you know, and so as you press down with a poor quality needle, you're going to get skin stretching and then subsequently a lesser quality treatment. So this is something that's very important. And the next key thing is working with the FDA. So Crown Aesthetics has led the class in this respect to work with the FDA to set the standard and safety for these devices. So a Class 2 designation was created for motorized microneedling devices in the United States, and this is the device that for which general controls are sufficient to provide reasonable assurance of safety and effectiveness. And it's very important to look at these words because they're carefully crafted, curated, and negotiated between a company and the FDA to ensure that device that's on the market is safe. There's many devices that are on the market that do not have clearance that may be considered by some to be adulterated and have not established the controls to prove their safety and efficacy. So that's something to look at when you're looking at a microneedling device for your practice and think about the safety parameters. So we are going to talk about SkinPen, and there's lots of different things about SkinPen that I think are important. As you can see, this slide sort of building in front of us, you have a device that's validated to maintain a speed that is set on it. It has a computer in there that keeps that speed at 7,000 RPM plus or minus 700. So you have a nice tight tolerance in the speed. It also has good power, and that's important because in a busy practice like ours, like yours maybe, an aesthetic practice, you want a device that's going to be reliable, and you want a device that isn't going to require constant putting back on the charger, maybe between a few different patients. So you want something with good power that can last throughout your treatment of your patient. Cordless has been a big boon for us because we've had devices in the practice that are not cordless, and of course the cord tends to get all over. It's rubbing across the area that we're trying to treat. So we really don't like wired devices, although, we didn't for a long time have the superiority of the battery technology that we have now. So for that reason, corded devices worked better back then. But now that we have good technology, good superior battery function, we can do a cordless device that works well. You also want a device that gives you feedback. So if you look at a SkinPen, hopefully you get to take a look at one, demo one, the LED technology sort of gives you a feedback on the performance of the device during the procedure. And the key, I think this is very most important thing, is that the handpiece is ultrasonically sealed. And this means it prevents penetration of blood, fluid or serum into the device, so it can be very easily cleaned. And we're going to talk about what that means when we look at the next slide. And so here you're looking at the tip, the patented tip that is used in SkinPen. And as you can see, all of the engineering as far as the setting of the size, of the depth of penetration and the moving parts are within this tip. So this is really where the sauce is made here in the tip. And this is replaceable and disposable. So when you remove this, the SkinPen itself, the device, is very easy to clean. And this is the part that becomes contaminated and that you throw out between patients and take a brand new one, a new device for each one. And so, again, we talked about validation to depth. That's important. The retracting of the needles is key. So you have a good reciprocating mechanism that's reliable over time. The sharpness we discussed, you saw what the needles look like. 80 minutes in use, even on scar tissue. So in some cases, I'd mentioned that sometimes scar tissue is treated. Mainly, we'll talk about the clearances that the device has, but scar tissue, and then backflow from cartridge to handpiece is also prevented with the technology. So it's very important to look at sort of a device. I've seen lots of devices on the market, just looking around, where there are a lot of settings for depth and whatnot that are on the actual handpiece. And those dials and things like that can easily trap contamination bacteria within. So, it's important to have a device that's manufactured and engineered like this. The other thing that's important is that you want something reproducible. So SkinPen, unlike many companies, they have a FDA cleared microneedling protocol. So from start to finish, you kind of have what you need in one turnkey package. And that's really not common to see in any other company. So you've got an advanced cartridge unit, which is your tip. You've got a rescue calming complex for after treatment, infusion. You've got numbing here. You have a disposable bile sheath. So even providing further contamination prevention when using the device, you can sheath your handpiece and protect your patients from contamination. And you also have a nice single-use treatment kit. So you really don't have to go out and shop for the different types of treatments you might use. So it's very important to have a nice sort of turnaround. And for our practice, for internal controls, for making sure that our estheticians or whoever is operating the device in our practice, whether it be myself or estheticians or operating the device, we have a nice standardized protocol that can be followed. It doesn't mean you can't use other protocols that you may have, but at least you're provided with something that can make life easy for your practice. So that's important as well. Let's see here. So these are the FDA validation studies for performance. So we talked about this, but I think it's important to sort of talk about it again. Needle durability. So why is this important? When you're treating larger areas, when you're treating the face, you're treating different types of skin, maybe acne scars, or maybe fine lines or wrinkles on the neck, which are the clearances that the device has. You want your needles to remain sharp over the complete treatment time. We talked about some of those needles. So that's something important. What they did was they did testing on level 6 synthetic skin. Really, that's a skin designed to replicate scar tissue. And what you do when you sort of look at the skin, I'd mentioned before, the skin has an elasticity to it. It has a rebound. So if you insert, if you take a tip of a pen and you touch the skin with the tip of a pen and you press down, you'll see that the skin will sort of go inward around the tip of the pen. But if you imagine the tip of the pen being a very highly sharp surgical steel needle that is smooth, you can imagine it will go straight into the skin very gently and really not cause a lot of elastic recoil. And because you don't get elastic recoil, you get depth of penetration that is measured to be what it's set. And that's what the next study shows you here, is that when you go from 0.25 millimeters to 2.5 in 0.25 millimeter intervals, you can count on the depth that you're selecting with your device. So that's very important to be aware of. The other thing, we already talked about some of these things, but needle cartridge proven not to allow transfer of fluid. The advanced cartridge units is engineered, you looked at the base of that before, with ingress protection. So it doesn't allow blood to transfer from that ACU to the SkinPen. You also have a disposable bile sheath for each SkinPen treatment that's also proven to prevent transfer of blood, fluid, or serum from contaminated gloves onto the device itself. You also have the standing cloth wipe, the HB wipe, that's been provided and proven to safely remove contamination from the SkinPen should you choose to use it. So using the cordless design, there's other tips and tricks, pro tips, reduce contamination by the cordless design. So we mentioned that the cord, getting on, touching the skin, it's not clean, it's not sterile, you don't want that. Using individual use glide gels. So sometimes people use back bar products. It's not uncommon, not a bad thing to do, but using an individual use glide gel ensures cleanliness, sterility for each procedure for your patient, because you are opening channels into the skin and you want those channels to be penetrated only by a clean, sterile product. And lastly, and finally, we talked about the ultrasonically sealed handpiece. And what you have there is you have a device that's sealed, so that way contamination is not getting inside. These are very important things that, they may seem like, okay, great, it's engineered very well, you become numb to all the things, but really these are the things that make this device stand out and make it a reliable, safe device for your patients, so that way they get great outcomes, it helps build your practice, and you can do this reliably and feel like you're doing a good thing for your patients. And so let's talk about some of the clearances. What is the device cleared for? So the FDA, through the FDA, the SkinPen is the first FDA cleared class 2 microneedling device, and it's used for treatment of wrinkles of the neck for Fitzpatrick types 2 to 4, and improving the appearance of facial acne scars in adults with all Fitzpatrick skin types aged 22 years and older. So, again, when we look at what the intended use, this is a negotiated statement between the company and the FDA, and this is what this sort of device is intended for use for, given its class. And this is a nice wide range of things that we can do. Acne scars are a big part of our practice. We treat them regularly. We have a lot of patients in our dermatology practice, young ones and adults that have acne scars. We have a lot of adult acne patients. And so I've published data on microneedling and acne scars. You can probably find that online or PubMed, but you can see that it is effective. So these are the two main things you can see before and after. And then, some of the studies that kind of go behind. We talked about how science-driven Crown Aesthetics is. So subjects increasingly reported improvement in appearance of their acne scars. You can see the improvement in 1 month and 6 months. These are patient-reported outcomes. These are what patients think about their scars after their treatment. Typically, you would do 3 to 5 treatments for acne scars and then look at them over time. It varies based on the individual patient. But you can see from subject satisfaction, again, it's nice to see the patient-reported outcomes. So most patients were either satisfied or extremely satisfied with the results of their treatment. And then nobody reported dissatisfaction with their SkinPen in the first month. And that's when you might expect somebody to report something. That's that maybe they, might have something to say in the first month because they experienced discomfort or what might happen. And in these cases, that was not the case. And then 90% of the subjects, 9 out of 10, would recommend SkinPen at both 1 month and 6 months post-treatment. So they're saying at both time points, they recommend the SkinPen to others. And you can see the results before and after as an example here that we have. So another couple of examples you see on the left, the one we just saw. On the right, these are more of your sort of pitted scars, ice pick scars, if you will. They're harder to treat. They're in the class by themselves. With acne scars, 85% of acne scars are atrophic acne scars, which are the typical rolling hill acne scars that you might notice on someone's face, typical thing. There's also boxcar scars, which are sort of have straight edges like a boxcar. And then you have these pitted sort of scars like you see here, which are very difficult to treat. But you can still get some improvement with using microneedling SkinPen. So that's very nice to see that the outcomes are there. Here's a publication looking at the efficacy and tolerability of a device for treating wrinkles of the neck. So, is this tolerable? Is it too painful? Whatnot? So, microneedling increases collagen types 1 and 3 deposition, and that's important. And so in this study, what they did is they took a look at 35 subjects that got 4 treatments once a month, a very typical regimen we might use in our practice, using the depths of up to 2.5 millimeters, which we talked about are verified. Wrinkle assessments performed by 2 trained blinded raters at each subject at baseline and then 90 days after. So using blinded raters is to reduce bias. So they're not they're not speaking to the patients, whatnot. They don't know which treatment the patient received. They simply know that they were treated and they can see the outcome. And you can see example here of the before and after. 94% of the patients noted improvement in their wrinkles, and it would be expected from a good quality microneedling device that they should get improvement in fine lines and wrinkles of the neck, even though so much as to see a little bit of improvement in the upper part of the neck there. That's nice to see as well. Patients were almost universally satisfied with the procedure and would recommend it to others. So it is improvement you can see. You sort of have to get your hands on it and try the device in your practice so you can sort of see the outcome for yourself. And here's a couple more, saw the before and after on the left that you saw in the last slide, and then another set of before and afters on the right showing improvement of the fine lines and wrinkles of the neck as expected from the device. And so that's very good to see. I'll leave that for a minute so people can take a look at it and see the smoothing of the skin, okay? And then here, some more examples and pictures of, I'd say the picture on the left, it's okay. It does show nice improvement, but the lighting is a little off. So, me, I'm very into high quality pictures. Sometimes they're not always available. We use a lot of, in our practice, we use cameras, we use iPads. So we try to get photos, but in order to get really, really, really high quality photos all the time, you kind of have to have a standardized photography system. Like on the right, you can see that's a little bit more standardized, and you can see the consistent blue background, consistent lighting, and that's where you can really sort of see the difference there when you have consistent lighting. So that's nice to see as well. So, clinically, you have a winner. You have good efficacy, safety, a device that's built to last, and to be a good partner in your practice. And that's what we're looking for. So, as a business person running a practice, I'm sure many of you are, running a practice, an aesthetic practice, or otherwise, why would you be here? You want to find the right device that's safe for your patients. Microneedling has been studied. You've seen all the publications that have been talked about. So now the question is, what is SkinPen going to do for my bottom line? And you can see here that you can customize treatment plans based on the needs of your patient, with revenue, increased revenue with opportunity using packages. Sort of our practice, we tend to use packages. We tend to combine with PRP. Patients are receiving that as well. And you can sort of see if you just come down the line here with the SkinPen treatment with the kit, you can see that the price to purchase it, $79. What you charge the patient, there's a range of what might be appropriate in your area. You can see gross profit. There's a low barrier to entry here between purchasing the device and then the consumables that are associated with it. But what's nice, it's not a high barrier. So this is a procedure that you can get into without spending $100,000, $50,000, $150,000, $200,000 on a device that you then have to make up that revenue before you actually start making any profit. So it has a nice high operating profit, which we like to see. And this is sort of a per patient, sort of just a pro forma of what you might generate. You may think of it differently in your practice. You might talk about whether it's going to be on a per patient basis or per day basis or whatnot, but you can sort of see, I think the most important number on this is the operating profit, 71% and 77%. That sort of gives you the idea of how profitable this can be. So most of the money that you're spending most of the money that's received by your practice is coming into your practice and not being spent on the consumable for the device. As far as the time, SkinPen for face and neck, about 30 minutes. We use topical numbing in our practice. It's quite common. You saw that there is a nice package with the numbing there for you to use with the device. It's delegatable. In my practice, I can do it, or my estheticians can do it, and I've delegated that to my estheticians. They do a great job at it. Perform SkinPens. I recommend it off of my clinic quite frequently. In our practice, just as a pro tip, we have a treatment plan that we use, a treatment quote sheet we call it, in our medical record system, that while I'm in the room with the patient, maybe talking to them about cosmetics, my clinical is documenting that on a treatment quote sheet, which can be seen by everyone, everyone that needs to in the practice. Same thing for products. So whatever I recommend, they get to the front desk, that is right there for them, and the front desk can complete the scheduling and say all of that procedure. So it all sort of happens in real time. It's important to be able to document and then transmit that information to your staff at the front. If you have an office that has, has a front desk, if you're doing things yourself, that's okay as well. You can certainly document a treatment plan for your patient quite nicely. And so why do we need these devices? Why are they good? I mean, we've talked about a lot of things here, but clinically proven safe and effective with excellent results. really, most people could benefit from the procedure. Most practices can benefit from the procedure that are doing aesthetics. We like it. It's a natural approach. So what are we doing with the product? We're stimulating collagen production. We're stimulating a natural wound healing process, and that's allowing our skin to regenerate. With my patients in the clinic, I talk to them about, just to think about the analogy of aerating a golf course. So, you see how they go out there and they actually go and make little holes in the golf course to create thicker grass. So they take little plugs out, and when the grass heals, it actually heals stronger and thicker and better. It's pretty similar to what we're doing with the face. We're creating a natural wound that the body can then heal and bring in, recruit stem cells from the bulge around the hair follicle that are deeper in the skin and repopulate that surface and turn on our collagen production mechanism. So it's also a simple, short, and comfortable treatment. The downtime is not excessive. We're talking about a few days to a weekend type recovery period for patients in the most cases, and you get a really high value for your dollar spent with this device. So really, it's a hands down winner. It's certainly important to have a variety of treatments for your patients within your practice. We have lasers and body sculpting and all those things as well, but SkinPen has really been a consistent performer within our practice. And so talking about SkinPen, also Crown Aesthetics has brought us a great PRP system. And so these are some of the things you might want to think about when you're looking at PRP. So PRP, it's important to sort of look at the platelet gradient. So what you're seeing here is how the centrifuge process is done on the left by many companies and on the right by Crown Aesthetics. And you can see the big difference. So what we're looking to do here with PRP, of course, we're drawing blood from our patient, and we're putting it into a tube, and we're spinning that tube down with a separator gel. And the separator gel is what separates the blood, the white cells, whatnot, from our platelets. And we're looking for platelets because they have numerous different compounds within that can help stimulate wound healing. They are the part of the body's first line of defense after you have an injury to the body. They're right there to help prevent clotting and bleeding, but they also are there to stimulate the initial part of the wound healing process. They release various mediators, too numerous to go through here, but they stimulate the proper inflammation to come in and heal. So looking at this left and right, the floating bucket mechanism, which is on the right-hand side, is very important. So the main point is that when you use a fixed angle centrifuge, which is what many do, is you actually spread out the gel separator over a larger area. It makes it thinner, so it's more likely for red cells to breach that into the nice PRP, platelet-rich plasma, you're looking for. So when you use the floating bucket, where the test tube gets horizontal during separation, then you actually have a flatter, thicker separator, and so the platelets stick to that better. It also concentrates them in a smaller area, so you can pick them up better when you would draw them out. So this is an important little engineering tip here that allows Crown Aesthetics to get better platelet counts from their treatments. And the platelet gradient, this sort of gives you an example of what we're looking at here. So with PRP, we're talking about the number of platelets as compared to normal, compared to the blood itself when it's just simply spun down normally. So, or the way the concentration is in the serum without spinning it down. So when you have a larger tube size, so they come in 30 and 15, and it's a personal choice of which one you want to use depending on how much PRP you're looking for. But based on the concentration that you sort of know, you can determine how much platelet-poor plasma needs to be taken out to get your desired concentration. As you can see, larger tubes give you a more efficient platelet concentration and give you more platelets bang for your buck than a smaller tube, because you have a wider, larger area for separation, and you can get a better concentration toward the top of the gel separator. You're going to be withdrawing those platelets into sterile tubes or whatever, syringes or whatever you're going to do, and then you can use that to treat your patient. So this is just to give you an idea of how important it is to have a good, properly designed centrifuge. The other thing that I think is really important, something I speak about a lot, is what kind of company do I want to work with? And so being that I do research and being that I also see patients, I highly value a company that invests in medical affairs. As you may know, if you treat regular patients and whatnot, medical affairs folks are our liaison between the company and us as far as science goes. So they're the kind of people not to put anything down on salespeople because they do their job excellently, but sometimes you want to talk science with somebody and you don't want to talk about exactly what you may talk about other questions you might have in your practice and how you might employ the device. You just want to know about the science. You want to talk through a paper, a publication, a poster at a meeting. Those are the folks that you talk to, and the companies that invest in the science side of their company and the education piece are the ones I prefer to work with. And they typically also have support staff. It's very important to have those folks lined up to help make your life easy when you need to get product for your practice. Industry leaders as far as development and refinement, Crown Aesthetics has put the effort and the work behind their products, as you can see. They also have very strict quality control and oversight to make sure that issues are minimized. And they also have a good supply chain. Nowadays, of course, that's key. Many of the companies I work with, product companies I work with, they're not doing very well in getting product to us even now. And as you know, the supply chain and inflation have been a huge issue for many of us. So a company that can help minimize that is helpful. You don't want to certainly be running out of tips and treatment kits when you have patients on your schedule. It's a loss of revenue for your practice. The other thing is adhering to FDA guidelines, not promoting PRP for other that it's supposed to be used. We talked about the clearances, talked about what the device can do within the FDA FDA clearances that have been established, offer information relating to the concentration and whatnot that's got the science that can back it up, and then as well. And so, once you have a device in your hands, of course, you can use that for, what you may want to use it for, but that would be considered practice of medicine and beyond the scope of this talk today. Also important to look at clearances. So you can see this here that the 501k clearance, 510k clearance process has been followed, and you can read about that as well and ask questions. So sort of the wrap up for the general presentation is that the ProGen PRP system, you can see it's shown here. It's a USA made product. You've got 15 ml, you have 30 ml tubes, depending on what application you are using it for. If you have a 30 ml, I mentioned before, but you have a higher platelet recovery percentage with a larger tube as far as the concentration goes. It's a more efficient process to use a larger tube. That's why many physicians in other PRP worlds use very large tubes, maybe 60 ml or whatnot. That may not be appropriate for the type of work that we do. Using in the operating room is very different than what we do. But this device is suitable for both office environments like mine, and then for those who may be using it in the operating room for those indications. It's also a rapid collection of the platelet concentrate from a low volume blood draw, and the centrifuge time is 10 minutes, so that's fixed centrifuge time, and that's quite handy. We have centrifuges in all of our offices, so we can perform PRP at any office that we are at. It's very also, very easy to store. The SkinPen, it's small, doesn't take up space. The PRP boxes are not large, and so we have plenty of room. They don't need to be refrigerated, so everything's pretty easy to keep on site. You can see here, just in summary, a fast and easy way to produce platelet-rich plasma with the Crown PRP system. Large tube for high capture rate. You've got different products to meet this new needs of your practice and your patients. You can use it in operating room if you do that, or within your practice. Easy to collect, rapid processing time, and then flexible technology with 2 different tube sizes. And these are USA produced products, hopefully minimizing supply chain issues. So on to the integration strategy. So Crown Aesthetics has really taken this to heart as far as what they can do to help bring this to your practice and make your life easy while you are, building your practice with this. So they've got great education online. They've got educational content about the history of microneedling, all this is included with the purchase. The clinical data is present, and then it can help you generate questions maybe with the medical personnel. They also are great about providing on-site training. I utilize that for my staff, myself, to help us, do all the different things, talk through the talking points of the device, of the treatments with our staff, with our phone staff, front staff, come into the office, go do some procedures together, and sort of learn the device of how to use everything. And they're also great about helping you conduct events. So we do a lot of events at our practice. Our biggest event is our Glow Night, which we do every year around the holiday time, early November. We usually get 200 or 300 attendees. The past multiple years, we've done it as many have done virtually. And now we're sort of doing a little bit of a hybrid where we have the event virtually, and then people come by and pick up, say, their prizes or whatnot. But we have everybody on Facebook and Instagram, and actually that's increased sales quite a bit. Interestingly enough, our year-over-year sales in our Glow Night event annually has increased each year. The virtual has actually raised the reach quite a bit. So we're actually going to continue doing virtual events, even though we can do more in-person events now. We're still going to have that virtual option because it really allows a lot of people who weren't able to come on site to see our practice, where they're busy, they're at work, and we allow them on that day to contact us any way they want. We don't care how it is. If they do it, they get to us that day, they get a message, they do whatever, they get the specialists that are there for that day. So it's been great this has been great. They also have a provider locator, which is quite helpful, that you can connect with your website. They've received a lot of visits, almost 400,000 since 2019. And I said to Lauren, I said, hey, how's that growing? You know, are we getting growth there? And she's like, yes, we are. So you can see this bottom stat, 45,000 patients visited in the first half of 2022. So that's growth of the practice locator. So once you've got the device and you're up and trained, you'll be able to join the provider locator so that you'll be easily found and promoted so that way your practice can be found and your folks can find you. So that's key. They've also done a great job providing marketing materials for your office, for your website, both in microneedling and PRP in form of brochures, how-tos, information for the patients, so that way you can provide that for them during consultation so they can, you know, more easily choose which procedure they like to have. So these are great. These are good things to have. You want a company, they've got a nice complete package for us, and for that reason, it's become quite valuable in our practice, and we've been using the device for a number of years now. So in conclusion, you know, we got plenty of time for questions. We did pretty well on time. So we'll have a good 20 minutes or so to answer any questions. Lauren's going to sort of moderate that process for us. But SkinPen and PRP, great advantage for your practice, USA made, and I think it's a winner. I think you'll really enjoy using it. And I really thank you for taking the time to be here and sharing with us, and I look forward to answering some of your questions.
Perfect. Thank you so much for all of that information. I found it very beneficial, and I'm sure everybody on this webinar did. As he mentioned, we will take some time now to answer Q&A. So if you do have any questions, please type those in the bottom right-hand corner of the chat box, and we will get through as many as we can. So the first one that we had come in is, can you comment a little bit on the downtime from microneedling? What do patients typically see? What does it look like? And how long do you think that it typically lasts?
Okay, great question. So for downtime, what I tell my patients is 2 to 4 days. Because the SkinPen can be set to different depths, you can actually control that. So if you are looking for a lighter downtime, maybe a patient has an event coming up, they just want a freshening up, you could do a 1 millimeter depth microneedling, and you don't have to make multiple passes. You can do a single pass, you can do 1 or 2 passes. So once you're trained up on using the device, you can control that downtime. To me, if I'm looking for outcome or results, downtime's okay. I tell the patients to look for that. What they're going to experience most likely after is a sort of a pinkness to their face after treatment that is moderate in nature. They will later, over the next 1 or 2 days, experience some bronzing. The face looks sort of like a sunburn, I would say. They may get some peeling. They don't get blisters. There isn't any craziness going on. There isn't any crusting going on. It's sort of a general bronzing, and over time that just sort of fades away. I have had the procedure done multiple times. Typically, I get a 2-day to 3-day recovery time, and I'm back in business after that. But again, that's very easy to sort of control the depth. You can also control the depth, control the efficacy by spacing the treatments a little bit more, a little bit less. There are folks that say, you know, doing it more often, you know, even though the patient's not all the way healed, you do another one, you can create sort of an additive effect between treatments, or space them a little bit more apart if a patient needs a little bit more of a break or they have a schedule, whatnot. Those are all variables that you can sort of dial in with your practice. So it's a great question.
Okay, perfect. The next question, how do you typically recommend patients packaging or pricing the microneedling treatment? Do you do it by a single session, or do you normally sell these in a package of 3, 6 at your practice?
So it's a great question as well, how to price things. So we have gotten away from selling a lot of packages to patients because I feel like they're more likely to join treatment. We tell them how many treatments they need, how many we're recommending, but we don't sell them all the treatments up front. What we'll do is we'll recommend using our treatment quote sheet within our medical record system I'd mentioned. On that, it's like a little table. And on the left-hand side is a column for the quantity. The next column is a column for the procedure. And it actually has a cheat sheet with the individual price right after each procedure. The next column is the price. So we'll say it's $450 a treatment session. We'll say SkinPen $450 per treatment session. And then the next box will be the notes section. The last one will say what we're doing. So this is for acne scars, full face. So that's how we do it. So we'll say, okay, 3 to 5 treatments, SkinPen Precision. Here's the price per treatment, and here's the area that we're treating. And that becomes their regimen. And of course, they receive all the pre-post care directions and instructions before they walk out of the consultation and schedule their treatment. So that's how we do it. So we tell them what they're going to need, but we don't, I don't like a lot of money just sitting there unused, because sometimes people buy things and then they don't use it, and we get a lot. We don't like having a large amount of unused treatment monies in the system. We have to account for. So we like to just do it as we go along. Patients are really like the idea of being able to just pay as they go. We collect a deposit when they schedule each treatment of half the amount, and the other half they pay when they come in. And we have a standardized no-show fee, and all that to sort of encourage people to come to their appointments and have their treatments done. So that's how we do it. Everybody's different. Some people like to sell packages and provide discounts and things like that. We've gotten to the point where we do less discounting and more value add, because sometimes discounting can be seen as I don't know, maybe a lessening of the service, like a lessening of they're discounting it, sort of is that the good quality? So we like to just charge really good, fair prices, maybe the Apple computer model, where they don't really discount things. They just provide a really high quality product for a fair price.
Okay, perfect. Great answer. Next question. What type of provider most commonly performs microneedling with SkinPen in your practice?
So in our practice, SkinPen is performed by our licensed esthetician, who is, they have a board of cosmetology, I believe, in our state. Every state's different, though. So you really have to look to your state law to see who can perform the procedure based on the class device. I think in most states, I would say, generally, and not knowing all the laws or anything like that, for all the other states, that a nurse practitioner or a PA, physician assistant, can do it as well. If that's the kind of practice they might want to have, of course, a physician can do it, an MD or DO or what a physician can do it as well. But in our practice, our licensed esthetician does that in our medical under supervision by a physician, and that's how we do it. And also we can do it, as the RPAs are if we like to do it ourselves, we can do that as well. But she's got the whole setup, and she does a great job.
Okay, perfect. Now, how long does it typically take to do a face and neck for a first-time SkinPen patient? Do you ever worry about the SkinPen needing to be recharged?
No, that's the one thing. As long as it has a charge, it works well. I mean, I would say, I'm guessing, because I'm not hands-on with it as much anymore as I used to be, that every 3 or so patients, you're going to have to recharge it. So typically at lunchtime. So you can get through your morning, no problem. You throw it on the charger during lunch. You can do the afternoon. I think a lot of practices that are busy using, like I said, we have more than one device. So I think of many practices that are doing a lot of SkinPen just have 2 of them. The barrier to entry, the cost of entry is reasonable. So that way you can actually have 2 devices in your practice. Maybe you have 3 devices, so you don't have to ever worry about having downtime. So that hasn't been a problem for the practice. As far as the time goes, depends on what she's scheduling. It could be 30, it could be 40, 50 minutes. Sometimes she likes to incorporate a little bit of, spa type treatments as part of her treatment. So maybe she'll book an hour, maybe she'll book 50 minutes or 40 minutes. But I think if you're busy, you can, once you're patient, this is for first time, I think maybe booking an extra 10 minutes would be helpful for consultation, because that's a great time. And estheticians can also, or whoever can also, talk about other services that you do. So you've got the patient there, you may talk to them about products and whatnot while they're numbing, and other services that you have, so they can walk out with a regimen. So that's important. So you can get through it in 30 minutes. If you try to just get them in there, numb them and do it, you can do it. But I think having 40 minutes is probably a nicer experience for the patient.
Okay, perfect. No, that's wonderful. Now, how many treatments in your practice do you guys typically do on a weekly basis?
So daily, she's probably doing it between 2 and 4 times a day. She also does other things. So our esthetician does, a full suite of facial procedures and peels. So she's not just doing this one thing. So on a given day, I'll look at the schedule. She may have 2 to 4 microneedling treatments on her schedule. Some days more, sometimes less. So say she's doing 3. That's 3, 6, 9, about 12 a week, maybe 10 a week. So it varies based on the time of year. It varies based on what specials we're offering. So we are happy to be offering a special, say on peel, then she may get more peels and she may get less microneedling during that time. So that's about on average. I mean, it's variable. I think everyone's going to have different practice, but the procedure is so easy to recommend. It's safe, it's effective, so it's easy to recommend to your patients. Oh, and also if you're doing PRP, of course, you need to build that time in. So what we do there is we build an extra 10 minutes and a little space between the appointment, and we build a blood draw, a 10-minute blood draw time in. So they'll come in for a 10-minute blood draw. There'll be a little break there while they're processing the blood and getting that spun down and drawn up and ready for PRP, and then the patient will proceed with their treatment. So adds a little bit of time, but of course it adds some expense to the patient, so it covers the time and expense of the procedure. So that even adds more profit a little bit to your practice when you're doing the PRP together.
Perfect. Next question. You mentioned glow nights. Is this something that you do and sell SkinPen treatments during?
We do. So in glow nights, they've evolved over the years. We've been doing it for like 17 years. So, and we don't just do one event. I mean, we do different events throughout the year. We're doing a lot more virtual things. But what we do at glow night is we have all of our vendors come in, like maybe Brian or Mike Zucala or someone from Crown might be here, and we have them. Now we're doing it on Facebook and Instagram. But before pandemic, we were doing it. They would have a room in our practice, and people could just go in and out of the different rooms and talk to different vendors. And of course, we'd all be there our whole practice is there, and we're making treatment quotes and we're selling treatments, and people are calling on the phone, and it's it's a really fun kind of busy time. We have we used to serve really good food and some wine. People come in. Nowadays we do it all virtually, but we do some giveaways, we do some prizes, we have drawings, we have a radio personality that's talking and providing sort of like MC services during the event, and we do that online. So now we're doing with our online version, we're just making a ton of different videos, and people can jump on and watch different videos during the event, and then contact us to purchase treatments and get treatment quotes. So yeah, the glow nights are a lot of fun. They're definitely worth it to plan a great event. They're a lot of work to plan, but you can do very well selling treatments. We typically don't perform treatments on patients during that time. What we do is a few demos. So we schedule everything for other days, so we can just really just focus on being there with the folks that come.
Okay, perfect. No, that's wonderful. Now I've got a couple questions around this, so I'll try and combine them together. But can you use a 1.5 depth on the forehead and chin, or how do you determine the depth that you want to use on the patient?
So the depth determination has a lot to do with what's being treated and a lot to do with the patient's sort of skin type. So, if you just imagine different skin types, different patients, sometimes you have your hardy skin patients, maybe they're skin type 3, maybe they're of European descent, whatever. They've got hardy skin. Maybe there's a mixture of different, maybe there's American Indian, got hardier skin, different, people, different age groups. So someone that has hardier skin, we might use a higher depth. You can also sort of dial that in during the treatment. So imagine the area, sort of around the eyes, this area around the eyes, you're going to dial that down and use, say, a 1 millimeter, 0.5 millimeter, sort of closer to the orbital rim where the skin is thinner. On the cheeks, you can go deeper. The chin is hardy, good skin. Forehead, deep, it's good. You can go deeper on the forehead. So it's based on the patient's skin type. Someone that has very thin skin, for example, maybe someone who has more a photo damage, maybe on the photo damage scale is on the higher side. They have loss of collagen already. Their skin is thinner, sort of think of the sort of wrinkly, sort of sun damaged skin. That kind of skin, you would have to really dial it down so you're not tearing the skin or doing any damage. So you're gonna have to cut it down. But on acne scars, you can really go full depth and treat those deeper acne scars. And you can vary that through during the treatment. So what's nice, you can actually change the depth as you go along. And that our esthetician frequently does that. We'll vary the depth throughout the treatment on different parts of the face. When I've had it done myself, I can sort of feel when she's going a little deeper, or maybe the forehead, getting into it, the cheeks, and then maybe around the temples or front of the ears or around the eyes, she's gonna cut it down and do a little bit less. So that's the beauty of the device, is you really can control that in sort of real time. And I think that's going to be an experience thing, but just think of the skin, the depth. You can actually just take your fingers and sort of pinch the skin and look and see the quality of the skin that you're starting with. And hopefully, as you treat the patient over time, you'll build quality, be able to go deeper.
Okay, great. No, that's perfect. How would you explain SkinPen being a safe treatment to your patients, especially one that's interested in using an at-home roller?
So the roller, you just have to see it to understand what's going on with the roller. I'm sure a lot of people here know what I'm talking about. If you're doing a roller, the needles are sort of being dragged through the skin. If you look at my finger, instead of going straight up and down and making a nice, neat channel, they're sort of dragging. So as you roll that, the needle, as you will, goes into the skin and is sort of tilted and turned, and then it sort of comes out while the device is moving. So it creates more of these linear channels in the skin as opposed to straight up and down depths. I don't think it's a bad thing. There's a lot of good home use devices that are out there, but you've really got to watch the quality of these rollers, because they're making them all over the place. And that's where I think the needles are not of high quality in some cases, and that's where you can result in scarring or abnormal healing. The other thing to be aware of is the needles sometimes contain, I have a lecture in which I present allergies that can occur in patients who are nickel allergic, and we have about 10% of our population that's nickel allergic. So depending on how the needles are made, what quality they are, there may be exposed nickel or cobalt or potassium chromate or other things in those needles that can create allergies, and that can create scarring and track marks and things like that. So I tend to tell my patients not to really, I don't really feel that comfortable with that. I don't recommend home. And I talk a lot about home use devices, but I don't recommend people microneedle at home with rollers, and there's some great devices out there that are good, but it's not something I typically tell my patients to do, just for those reasons.
Okay, perfect. The next question, and I think I can answer this one, how do I become a premier partner on the physician locator? So we do have a premier partner program. If you are interested in joining this, please reach out to your local territory manager. There are some really great perks for this, one of those being getting the designation on the physician locator. There's some cost savings. You'll get your shipments automatically, so your local territory manager will definitely be able to give you the details around that. The next question is, do you recommend a SkinPen monthly treatment for 3 months for neck wrinkles and then take a break for a few months, or how do you typically diagnose that?
Yes, so good question. Monthly is sort of a default. So if a patient has medium quality skin, where I think they can tolerate monthly, that's great. When we do the PRP, it's also once a month for 3 months, once every 3 months for a year. So they get 6. Or we recommend 6. You could space it out. If your patient maybe, doesn't have time to come that often or whatnot, you can do 6 weeks or 8 weeks. I think as you get beyond 8 weeks, you probably might be losing some of the benefit of the healing time that's sort of being built, of the healing process that's being built between treatments. So I think a good standard is monthly. I have seen people do it as frequently as weekly or every other week. And pre-treating and doing all kinds of different things. You can learn and read and talk to science about that. But I think monthly is a good industry standard of care place to start.
Okay, perfect. Now, when you're not microneedling in your practice, what is your typical endpoint? Do you do it based off of pinpoint bleeding or number of passes normally?
I think you're right. It's I'm sort of looking at the skin. I'm looking for a nice even pink sort of quality. You don't always get a lot of bleeding. Everybody's a little different. So bleeding is not always the endpoint that I use. Sometimes you don't get that. When you're doing 1 millimeter, 1.5, you're probably going to get much bleeding as well. And plus, you don't want a lot. You don't. I mean, blood's fine. Getting blood. I'd rather use PRP. So I'm not looking to get. I'd rather be more efficient and use PRP and have that concentrated platelet serum on the surface of the skin. Because if you get a lot of blood, you're actually getting a lot of inflammation. Because you've got the red cells with iron, and there's inflammation. The white cells are coming from the if you are not getting if you're using the patient's own blood's coming up and that's on the skin, you have to clean that off. But I don't want to microneedle their blood back into their skin because it's going to be inflammatory, create inflammation that we don't want. So I'd rather have less bleeding and use PRP. So my endpoint is going to be more of a general sort of pink, even pink color to the skin during treatment, minimal swelling, maybe slight, you're going to see a little bit of slight edema. That's good. That's normal. That's healthy. A very even sort of quality. You'll see certain parts of the skin won't get as pink quickly. Of course, the forehead may not get as pink quickly, but certain other thinner areas will. So I'm looking for the sort of even pink color, not so much bleeding.
Okay, great. And I think we have time for just a couple more questions. So this question, how long do you typically recommend patients avoid the sun following a microneedling treatment? And are there other things that you recommend them to avoid as well?
Okay, so as far as sun goes, I typically tell them to wait till they're fully all the way healed, but I prefer them to be very careful for the first 2 weeks after each treatment. We recommend a host of different sunscreens in the practice that they can purchase at the practice that are of high quality. I do tell my patients to use a tinted sunscreen. In the beginning, during the healing process, they shouldn't be using sunscreen at all because I don't want them to have anything on their skin while the skin is healing, while those channels are open. I don't want any sunscreen because I don't want that getting in. I'm just going to use post care. Once they're fully healed, all the channels are closed, then a good quality sunscreen with a tint is great because the tint blocks visible light. There's no FDA cleared visible light blockers yet. Iron oxide is one of the ones that may be an inactive ingredient within many sunscreens, but tinting can help block visible light. And of course, you want your ultraviolet light blocking that can help with melasma. So that's kind of what I recommend. That first 2 weeks is pretty critical. Of course, I recommend all my patients not, because they can develop, even after that, if they get bad sun, they can develop pigmentary changes. So less is more, be real careful, but definitely use good quality sunscreen and protection.
Okay, perfect. And last question, are your patients typically pretty happy with the results that they get from their SkinPen treatment?
Generally, yes, I would feel like they're doing about as well as your study showed. They're generally happy. They come to complete their treatments. It's easy to sell to recommend and sell the procedure to our patients. First timers, they need to understand they're going to have topical numbing on their face. That I tell them they're going to feel it a little bit. 2 to 3 out of 10 is what I tell them for pain. That's what I've experienced. So even though you use topical numbing, you're going to find a few places where they might be a little ouchy, maybe around the temples or a couple of little spots around the lips and whatnot, but typically very tolerable. So, like I said, we've had this procedure in our practice for a very long time. And so it is popular. It's very profitable. You don't have to do that many to do well at it. I wouldn't be here, and it's a great question. I would not be here talking about it in the way I do if we weren't getting good outcomes. So, I recommend, you think about it. It's a good thing to have.
Okay, perfect. Well, thank you again so much for your time this evening, Dr. Schlesinger. I believe this concludes our webinar, and we hope that you all have found this as informative and helpful as I did. We also encourage you to reach out to your local Crown Aesthetics representative to discuss additional ideas on how to draw patients into your practice or get any questions answered that we weren't able to answer this evening. Thank you all again for your participation, and on behalf of the entire Crown Aesthetics team, have a wonderful rest of your night.